Hello, hello. Good day, everyone. How you doing out there? I want to say a big thank you to everyone who has reached out to me and who has been watching, and a few people who has also given, some corrections here and there. We are all preparing for the exam, so corrections are welcome. And to people who have also given, a few people approached me and told me, "Oh, Ruben, this is how I approach the questions." And I appreciate that. That's also good. So those are some of the things we can continue to share with ourselves and in this CHES community. All right. So we're back again to discussing the questions. And tonight, like I said before, we are just going at random. We are not particularly going in, in a sequential order of 1, 2, 3, 4, and all that. We're just going to pick at random. So today, we're going to be looking at area 2, responsibility, which is planning. Now, I believe personally that this is probably, it's either you choose between implementation and planning as the trickiest part of this whole exam. And why is that? Because you have all of the theories, you have different models, you have different things to really understand, not just to read over, but you have to be able to state differences between these things. And I think that makes area 2 one of the trickiest parts in this exam. So what I have decided I am going to do is to make another video to explain some of the complex terminologies. Okay, let me put it that way. So I'm going to make an extra video to record and explain some of the complex terminologies in this area too, so we can have a bit more of clarity. So we are not only conditioned to these questions, but we can use that knowledge to answer similar questions, right? Similar questions. So tonight, I think we have about 20 or 22 questions. I'm not so sure. All right, so let's go straight into it and let's see what we can achieve tonight. All right, so area of responsibility 2, and that is planning. Question number 1. When engaging priority populations in program planning, participants are defined as what? A says individuals who will be funding the program, print and broadcast media. C says community members who will receive the program intervention. Hold on, please. The program intervention. And D says researchers who will be evaluating the success of the program. So if you look at all of these options, the first option says individuals who will be funding the program. That is the category of people we refer to as stakeholders or partnering agencies or funding bodies, right? So those are not the participants of the intervention or the program you're planning. B says the media, all right? So the media is not. Option C says community members, and this says the researchers. So who is a participant? This is a very simple question. A participant is someone who is going to be a direct beneficiary of the program, all right? A direct benefit. In fact, the sole purpose of calling someone a participant is for them to be a beneficiary of the program. And in this case, that will be community members who will receive the program intervention, okay? Who will receive the program intervention. All right, so we have here the answer to be, I believe, C, community members. All right, community members who will receive the intervention. All right, question number 2. I'm going to try to increase the font as we kind of go along the line so everyone can see clearly. And all of these questions, again, they are from the CHES book. A few of them are from the CHES book, just a few of them, right? Just a few of them. So question number 2. Question number 2, give me a minute. I'll get to that in 1 second. All right, question number 2, sorry about that. My computer was gonna go off. Which of the following is not one of the 3 important criteria or the 3 F's of program planning? So this question is actually probably, let me say, the first thing you need to know about planning a program, right? This is the first set of criteria you need to know. So which of the following is not part of the 3 F's? So honestly, if you don't know the 3 F's before this question, you're just going to be guessing 50-50. Because funding could be a part of it, fluidity could be a part of it, flexibility could be a part of it, and of course, functionality could be a part of it. However, in this case, it's a textbook answer. So the 3 F's are fluidity, flexibility, and functionality. So the one that is clearly not the answer is funding, all right? So the answer here is A, and that is funding, all right? So that's not part of the 3 F's. You might look at the question and be like, well, funding is important. It is important, but it is not a part of the important criteria, because your program planning must be fluid, all right? Fluid in terms of there is a continuum in the processes. It's going smoothly. Flexibility, you are able to look at the intervention and say, oh, these are some of the things we need to change before the outcome, all right? Flexible. And functionality, fidelity. It performs what it was expected to do, right? Functionality. So what is not really important is funding. So question number 3, which of the following is an example of secondary data collection? Now, the most important thing you want to ask yourself here is, what is secondary data collection? Very simple. The data that you are using that you didn't collect yourself. It is not primary. You didn't collect it, right? So it was basically not done by you. It was done by some other persons for some other intervention on a government website, CDC, AHRQ, and the likes of those places. So of course, here the answer is going to be published literature, right? So for surveys, you can conduct surveys yourself. That makes it primary, not secondary. You can also write fresh letters yourself, new letters yourself, right? So that makes it primary. You can conduct interviews, focus groups, primary, all right? You're not getting that data from any other place. So the only one that you are really getting that has been used, tested, and reliable is probably literature review. So here the answer is C, and we have published literature, all right? Published literature, there's a mistake in the spelling. Literature, all right. So question number 4, and you know, the first 4 questions are really textbook questions. So question number 4, a vision statement are used or is used to describe a program, to describe where a program will be in the next how many years. This is textbook, right? So a vision statement is a statement that allows you to plan for the future, to dictate or to predict what the future will be. And that is time bound, all right? A vision statement is time-bound. So if it is time-bound, textbook-wise, it is usually 3 to 5 years, all right? So the right answer is 3 to 5 years, okay? So let's move on. Now, question number 5. Which type of objective is addressed in the following statement? After completing the program, participants will be able to discuss 3 strategies to reduce the risk of falling. Again, after completing the program, the participants will be able to discuss 3 strategies to reduce the risk of falling. Now, the question is simply asking us which one of these objectives matches the written statement. Every objective is a written statement. If it's not written, it is not an objective. Let's take that out of the way, okay? So we have, let's strike out the odd one, okay? The odd one here is environmental. Environmental objective, absolutely not. This is not talking about the environment. It is not talking about, social factors, not at all. So C is obviously not the answer. Now, let's look at outcome. Most times when we talk about and this is important because we have a series of questions on outcome and all of these things. So when we talk about outcome, we are looking at things like mortality, morbidity. What is the overall health status after the whole intervention has been done? Okay, has been done. So clearly this question isn't talking about morbidity, isn't talking about mortality rates, isn't talking about the prevalence of anything or the incidence of anything, isn't talking about the overall health status. So we are striking out outcome objective. Now we are left with the process of the learning objective. Now, in reality, either of these things can be true, depends on how you are looking at it. But like I've said before, this exam is to point out, or you are choosing the best fit for the question. So participants will be able to discuss 3 strategies to reduce the risk of falling. This is talking about knowledge. This is talking about our relatability to the information that has been given to them. This is more like the model in public health where we say it is teach the trainer. So if you are going to discuss strategies, it means that the objective you are trying to look at here is a learning objective. What have you learned? What are the strategies to the risk of falling that you have learned in the course of the intervention? So what we are trying to test out here is the learning objective. It is the learning objective, all right? Question number 6. So the answer here is, let me see. We said B, learning objective, okay? Learning objective. All right, so question number 6, let me increase the font a little bit. All right, question 6. Among program participants, smoking rates will decrease by 35% in 12 months. It's an example of which type of objective. All right, so you are saying smoking rates will reduce among the participants. Now, what is smoking? I've always said to us, you need to find out what is the most important part of this question. So this question, first of all, smoking rate will decrease is a statement that is pointing to change. It's a statement pointing to change. It is not environmental, right? It is not linked to any social factor. It is not administrative. It has nothing to do with policy. Absolutely nothing. All right? Learning. You don't learn how to stop smoking or how to reduce it. It is a behavioral defect. All right? It's an attitude problem. It is a behavior issue. So the objective you are looking at, it's what? Behavioral, habitual. So the objective here is clearly behavioral. Okay. So question 6, answer is behavioral objective. All right, so it's measuring the attitude, it's measuring the impact, it's measuring the effect on the habits. Okay, so question number 7. As people learn, which of the following yields the highest level of retention? Option A says what is heard, what is seen, what is done and said, and what is read. I believe this is one of the easiest questions in the CHES exam, so I probably won't be giving an answer to that question. I think everyone who's writing this exam should know what that is. Okay, so question number 8. Which of the following is not an example of a timeline for the delivery of health education programs? All right, an example of a timeline. Now, the truth about this question is every one of these options can be the right answer. Management by objectives, a Gantt chart, a PERT, a CPM, all of these things can be used depending on the kind of intervention you have at hand. However, the question says, which is not, all right? Please take note of the negatives. And in the CHES exam, one common thing is there are so many negative placed questions. So please be careful about understanding the question and reading meaning into the question. So, of course, a Gantt chart is a timeline model. It's a timeline delivery system, if you want to say that. PERT, evaluation technique. CPM, a scheduling technique, a monitoring technique, and all that. So the most obvious one out of here is management by objective. Management by objective. So 8, the answer here should be A, management by objective. By objectives, okay? Question number 9. The main drawback of pilot testing intervention is what? And it's simple. What is pilot testing? That is the first question you want to ask yourself, picking out this intervention to test on a small sample. All right? Picking out the intervention to test on a small sample. So options, let's look at the options. Option A says the result may not be entirely generalizable. Option B says it is often too expensive to conduct. Option C says too many of the priority population are involved, leaving few to participate in the actual intervention. Option D says the results seldom lead to changes in materials or strategies for the actual intervention. So all of these things can be true. It can be expensive to conduct a pilot testing intervention, especially if it is something, it's a program you are looking to expand to a very, very large population, all right? Pilot testing in those cases can be expensive, and I've been a part of such programs before. So option C, too many of the priority population are involved, leaving few to participate. Of course, that is the whole essence of pilot testing. You want just a small sample size. However, What is the main drawback? The main drawback in a pilot testing is option A. The result may not be entirely generalizable. It is difficult to make an inference from a population sample of 50 to 100,000 people. Now, you're going to have all kinds of bias in a survey like that. You're going to have all kinds of bias in a project like that, all right? So one of the main drawbacks and one of the things you want to look out for is that the results may not be entirely generalizable, okay? Obviously, it is expensive to conduct, but funding might arise, right? So option A seems to be the most ideal option here, okay? To be the most ideal option. All right, let's see. We get into to some of the most interesting questions now. Again, this is a textbook question. What percentage of the total program budget should be set aside for evaluation? Answer straight up, 15%, okay? 15%. It is a textbook question. However, when you read through the books and you probably get into the field, you will find out that most budgets will be showing you 10 to 15%, okay? But please, for the sake of this exam, go with 15%, okay? Let's all go with 15%. All right, so question number 11, interesting two questions. If the health education specialist begins the planning process by identifying desired outcomes, the most appropriate model would be what? Now, SMART is not a model. It is a kind of objective. Let's take that out, okay? It is a kind of objectives that you write down, right? Expectations for a program, expectations for an intervention. Absolutely not a model. Match is a model. Precede-Proceed is a model. Patch is also a model. So the question is saying, what is the most appropriate one? And another important part of the question, identifying desired outcomes. All right? Out of all of these the last three models, the one that really begins with identifying the desired outcome is the Precede and Proceed model. In fact, I believe that is the first step out of the Precede and Proceed model, okay? Now, however, I'm just going to explain why match is not the best answer here, okay? Now, match is not the best answer here because match has only 5 steps. So in a match model, outcomes have been identified before doing match, okay? Match is not meant to identify outcomes, no. You should have identified your outcomes. You should have objectives already before using a match model. So in this case, that is what makes the match model inaccurate, not appropriate for this question, all right? Because you have to start by identifying desired outcomes. So you really have to go with the Precede and Proceed model. So the right answer here should be C, option C, the Precede and the Proceed. Sorry, I'm not typing in capital letters. Bear with me. The Precede and Proceed. Okay. Question number 12. If a health education specialist wants to emphasize program implementation, the most appropriate model would be what? The same options, okay? So it is really important for us to understand what are these models. So they are not necessarily changing, right? So they are not necessarily changing the options. It's a bunch of options, and you have to decide which of those models is the most appropriate? So once again, let me go over the models. The first one says the Precede-Proceed model. The second one says match. I already told us SMART is not a model. It is a form of objectives that needs to be written down. So we're taking out SMART out of the options. So patch also, we're taking out patch. Okay, so the two things we're considering here is option A and option B. So which one is the most appropriate? Now it's saying an emphasis on program implementation. The Precede model just doesn't focus on program implementation. It focuses on planning, implementation, assessment, and evaluation. So that makes it 4 different processes. And that is why we have about 8 to 9 phases. And I said before, in the match model, we have only 5 quick steps, allows you to implement and evaluate. In fact, in the match model, you are not planning your program. You are not considering outcomes. You are not writing objectives. You are basically just implementing and evaluating the program, all right? So these 2 models can really be confusing most times. So how I try to differentiate it is this. One of them really starts from the scratch, while the other one really just picks on implementation and evaluation. So the right answer here, I'm gonna just write in front of it. Okay, let's not break it. Let's not break the flow. So the right answer here should be B, I believe, and that is match. Okay, and that is match. And another thing is you really need to understand the full meaning of these acronyms. Okay, like right now as I'm speaking to you, I have forgotten the meaning of match. I just understand what the model is. I cannot tell you this is the meaning of match right now. It's a multi something something, I'm not sure. Okay, question number 13. Let's see, question number 13 to 15. Okay, the best objective for a training workshop to build the skills of smoking cessation facilitators would be, upon completion of the training program, participants will be able to do what? Okay, so now, once again, once you see questions like this, the way you should be interpreting the question is this. How do the participants retain the information or retain the skill? All right, and the best way to retain any kind of skill that you've learned in a training program is to also demonstrate it. So this question is a pretty straightforward question. However, the interpretation of the question is what is important here. So for you to be able to build the skills that are necessary, you need to develop a retention skill. And the best way to have a retention skill is to demonstrate whatever was done in that program intervention, in the training and all of those things. So option D, it's pretty long. I'm just gonna write D as the right answer, then copy and paste, then copy and paste, okay? All right, question number 14. Let's see. Question number 14. By 2024, volunteers will distribute informational fact sheets to at least 50% of the program participants. This intent is an example of which type of objective. I think this is probably the most trickiest question in the planning section. Personally, I believe an answer to be right. I think it's wrong. So we're just gonna go over the options one after the other while I give the explanation, okay? So let's take a look at the question. We are believing that at a certain time in the program planning, the volunteers would have distributed the program materials, right? They would have distributed the program materials. Like I said initially, it is not summative. Summative is a totality of the whole intervention program. Now, when we talk about outcome, we're talking about mortality, morbidity, and the specific results you are looking into. So for example, An outcome objective here will be by 2024, cancer, let's say prostate cancer will have been reduced by 50%. That will be an outcome, okay? However, here we're not talking about a disease that is specific. We are not talking about a disease rate, not incidence, not prevalence. Okay, so we are left with two options, option A and option B. So volunteers will distribute informational fact sheets. Is it process or impact? I am going to go with process, because what is impact? Impact objectives is the knowledge acquisition. In this question, it's not talking about knowledge, it's not talking about learning anything. It's the process, the build-up of the whole intervention plan. So the answer for me here is going to be A, is going to be A, okay? A, let's see, process. All right. Question number 15. To provide patient-centered healthcare with excellence in quality, service, and access is an example of what? Interesting options. Again, I'm going to read the question. To provide a patient-centered healthcare with excellence in quality, service, access is an example of what? Now, is this an objective? No. Is this a vision statement? Let's start with vision statement, okay? What is a vision statement? A vision statement is a futuristic statement. There is nothing in this statement here that points to the future. It points to what they will be doing. It's not time bound. It doesn't have a time frame. It is not a vision statement, okay? Now, an objective. What is an objective? An objective is a specific, it is a specific attribute of an intervention. So for example, if I say if we're having an HIV intervention and I say the objective is to provide patients with home test kits, okay? That would be an excellent objective, all right? A mission statement is probably the most appropriate here because a mission statement is specific. It tells you what the intervention is about. What is this intervention about? It is about excellence in quality, service, and access. Simple, all right? So an objective, we have a good measure of specificity to it. It's going to be specific in nature. It's going to be specific in nature, all right? So the right answer here, let me see, is going to be objective. The right answer here is going to be objective, okay? Question number 16, behavioral and learning objectives may also be referred to as what? So every time we consider the behavior and the learning pattern, which is really the knowledge acquisition in a program, everything we are looking at is impact objectives. Very simple, okay? Very simple. So formative objectives is more like a process objective, is measuring the process stage by stage. Maybe you want to change something in the intervention, you want to improve the quality in the intervention. Those are formative objectives, all right? So here, you're looking at the behavior, you're looking at the learning, the knowledge at all times. That will be impact objective, impact objectives, okay? Impact objectives. All right, question number 17. Question number 17. When writing objectives for a worksite wellness program, the health education specialist wishes to measure any morbidity, mortality, and health status change that occurred as a result of the interventions. Which type of objective should be written? Now, I've said it over and over again. Every time you're measuring morbidity, mortality, and health status, it's always going to be an outcome objective. Why? Because in public health, the totality of everything we do in public health, the totality of every single thing we do is to prevent disease, is to reduce death rates, and to improve the health of the people. So that has to be the outcome of every intervention. Automatically, that becomes an outcome objective. That becomes an outcome objective, all right? Okay, so let's see. Again, question 18. To increase the rate of prostate screening, are we really in question 18? Oh, pretty fast. Okay, question 18. To increase the rate of prostate screening among men ages 50 and older is an example of what? This is still a statement, all right? This is still a statement. It is not a vision statement, all right? No. Goals are not, objectives are not statements, really. They are not really statements, all right? Again, the simple answer is still gonna be mission. It is a mission statement. What are we doing right now? What is this intervention all about right now, okay? What is it about? It is about reduction of prostate screening among men age 50. All right. Now, question 19. A health education specialist works as a patient educator at a healthcare institution. Part of the job is to work with patients who have recently suffered a heart attack. This type of prevention is what? I read the question again. A health education specialist works as a patient educator at a healthcare institution. Part of the job is to work with patients who have recently suffered a heart attack. What is the type of prevention? Now, in most cases, we have three types of prevention. In most cases, which is primary, tertiary, and secondary. So first of all, you can take out the option D. It is not really a type of prevention. It can be, but not really. The basic ones we have primary, tertiary, and secondary, okay? Now, what is primary prevention? Primary prevention is that prevention that you undertake before the problem arises, okay? So it's a kind of prevention that you do so that you don't see this public health issue arise, come to life, okay? You don't want to see it at all. So you're going on a primary prevention. A secondary prevention is what you do when the public health issue has started already. You are trying to minimize the impact of the disease or the public health burden. A tertiary prevention is what you are going to do after the secondary, which is to normalize, to stabilize the impact that has been caused by that disease. Now, this is a tricky question because this is not primary. The heart attack has happened already. So let's also strike out primary. Now, secondary. Now, secondary is what you do. A secondary prevention is what you do to reduce the impact, okay, of the disease, of the outbreak, of the pandemic, or something. However, take a deep look at this question. This question is saying two things: that we need a patient educator, and also this person has suffered the heart attack. This is a special kind of disease, so to say, all right? that an health educator has no answer for. It's not in our place as health educators to treat people for heart attacks. That's the function of a cardiologist. So you ask yourself, are you providing a secondary prevention or a tertiary prevention? In this case, this person has suffered the heart attack. You can't do anything about it. What you can do is to stabilize this person, which is an after effect of the treatment this person has received. So let me put it this way. This person, primary prevention didn't occur, okay, it didn't happen. Secondary prevention happened, went to the hospital, was stabilized, back on his feet, working and doing the normal things. Now we are introducing an health educator to do what? Okay, to keep up with the patient, all right? To give the basic information that this patient needs to know to maintain a standard of life. So that becomes tertiary. That becomes tertiary because in this case, a patient educator is unable to naturally treat someone with heart attack. We can't do that. So the treatment has happened already, but we are looking for someone who can educate this person on how to live better. So that becomes a tertiary prevention. That becomes a tertiary prevention, a tertiary prevention. Okay. Question number 20. Question number 20. Okay. Which of the following is an example of a correctly written learning objective? Option A, individuals participating in the health program will be able to identify 3 ways to protect their skin from the sun. Okay. Individuals in the program will increase sun exposure prevention activities by 25% by the 6th week of the program. That really sounds like a smart objective. Option C, 75% of individuals participating in the program will increase their knowledge, okay? And option D, program health education specialists will identify 10 new participants. No, that's not it. All right, so we are talking about a learning objective. All right, it's about knowledge. Knowledge. You hear the word learning objective, the first thing that should come to you is a learning knowledge acquisition. Knowledge acquisition. And of course, what really fits the bill here is option A. Option A, 20, option A, okay? Option A. Let's see. Okay, the 21, the social media campaign to change social norms related to teen pregnancy that was developed by health education specialists is reviewed by a group of adolescents. Feedback from these adolescents allows the health education specialist to make changes before implementing the campaign. What type of evaluation is this? Now, I'm going to take some time to explain this question and also explain the options. There are so many key factors here at play. All right. Number one is evaluation. We are evaluating a program that is solid, that cannot be changed. It is happening. Now, question 2, the second factor is this. We want to make changes before implementation. So you are thinking to yourself, or you are saying to yourself, which evaluation model allows you to make changes before implementing? That is key. Those are the 2 factors here. So let's look at the options. Impact. When we talk about impact, it's always about knowledge, right? Always about knowledge. You want to measure the knowledge, you want to measure the behavior change, the attitude change. This question has nothing to do with that. Absolutely nothing to do with that, okay? Summative, the totality, the complete outcome, the complete intervention package. It is not even complete. We are still thinking of making changes, so it cannot be summative. Now, what is the difference between a formative evaluation and a process evaluation? In all honesty, they literally mean the same thing with one difference. And what is the difference? A formative evaluation can be done, allows you to have an ongoing process before implementation. You can make changes to the planning, you can make changes to the written goals, you can make changes to a lot of things, but must be done before implementation. While process evaluation is only done after implementation to know where the quality of the program can be improved, where the performance can be raised. You can only do that after implementation, and that is process. So the question is basically asking us before implementation. So that will be formative evaluation. That will be formative evaluation. Formative evaluation, okay? Question number, let me see. Question 22, I believe, is it a CHES question? Okay, let's just go over question 22 and we'll wrap up from there. Following the precede and proceed model, assessing if the community members have adequate access to oral healthcare services, which type of factor in the educational and ecological assessment. So you want to assess if the community members have access to a particular type of service, all right? So it's enabling. Okay, the answer is enabling. Okay, I won't be giving explanation on this. It will be part of the next video I'm going to be sharing on area 2. So enabling, and it's also an CHES question. So let's move on to this. When planning a diabetes prevention program using the Precede-Proceed, data on high sugar intake will fall into which category? Intervention alignment is not really a category here. However, administrative and policy assessment are categories, but intervention alignment, there is nothing like that. At least not in the Precede and Proceed. Of course, in the broader public health scope, we should have something like that. Okay, educational and ecological. Well, this is becoming clinical, so educational may not suffice because you have to consider the literacy level of the person, right? So here you probably want to talk about A1C level. You want to talk about diabetes, okay? Insulin and all of those things, okay? So social assessment has nothing to do with social assessment. Epidemiological is the right option here because in epidemiology, we are able to measure the pattern. We are able to look at the trend. We are able to take account into data. In fact, the key factor in epidemiology is looking at clinical data to make assessments, to make conclusions. So that will be epidemiological. All right. So we have, let me see, 4 more questions. Okay, let's see. We've treated question 24. It's an CHES question. It's like something that we have when we started these questions for area 2. So the intervention program has been adopted. It means it has been started, it's in progress, ongoing. Priority population is ready to participate. The implementation team wants to know their task, due dates, and they want to track the team's progress. What do you use? What kind of chart do we need to create? All right. Logic model probably is only for input, output, activities. Then you have the outcomes. So logic model does not allow you to track activities. That is the keyword. TDTL, well, it's a timeline system. However, in TDTL, you are unable to go after the due dates, and you are also unable to prioritize the task in TDTL. It only gives you a timeline. This should be done by this time. It's like a scheduling system, okay? You are unable to track the progress. CPM allows you to do most of these things, but CPM does not allow you to look at the progress rate of the team. In CPM, you're unable to do that. You're unable to do that. However, in Gantt chart, if you have done a Gantt chart before, you would know by reading this question. It is Gantt chart, because a Gantt chart allows you to start the program in that chart, allows you to write down the dates of completion, allows you to monitor the date, allows you to look at the progress rate per time, because it is a continuing chart. It is a continuing chart, okay? Let's look at the last two questions. Oh, wow. Okay. These are all CHES questions. I'm trying to look if we have a CHES question here. Yeah, 27 is a CHES question, I believe. Which dimension of REHAIM is used to evaluate the extent to which health education intervention components were institutionalized within an organization's operations long-term? A lot of huge vocabularies, right? All right, so the question is basically asking you that we have a theory that is called REHAIM. Now, what part of this REHAIM allows you to do an evaluation of an intervention after it has been conducted, after it has been implemented? All right, so obviously we are looking at evaluation as the question suggested, so it cannot be implementation. Reach is possible, because in reach you are able to know the extent to which your message has gone. However, we want to see the extent to which the intervention has been adopted, has been used over time. All right, so technically it could be adoption, because you could be saying to yourself, oh, in adoption we are able to see how this program has been done. However, we are trying to measure the adoption rate, because we are trying to do an evaluation of the implementation. So it has to be maintenance, the long run, okay? It is a long-term thing. How is it, the things that has been implemented, that are in use in the organization, how are we preserving, how are we maintaining these things that has been implemented, all right? That has been implemented. And of course, the last question is also an CHES question. And I'm just going to wrap it up here. A health education specialist is using social cognitive theory to plan a community-wide program to prevent alcohol use. One aspect of the program includes a curriculum designed to help youth resist peer pressure to drink. So, to increase self-efficacy, the curriculum should include what? Okay, so here we're trying to look at, for them to be able to retain this skill, what should they do? And it's pretty simple, all right? It's not about prizes. You can give out incentives and people are not really listening to you. Activities that reinforce negative consequence, all right? So the messages we tailor in public health most times, they are positive consequence messages, positively tailored messages. So train peer leaders? No, because we are talking, the question has already talked about individuals, okay? Individuals. So we are going to make them practice, have activities that when they leave the program, they can make use of those activities to resist peer pressure, okay? So now we come to the end of the planning area 2. A few of those terminologies, I must confess, they can be conflicting or confusing at first. So even beyond these questions, I really want you to go back and pay attention to goals, to what is the meaning of goals? What is the meaning of mission statement, vision statement, objectives? You need to understand what the differences are. It is pretty important. I believe we're definitely going to have questions coming from there. We're also going to have questions coming from objectives. It is important to understand what these objectives are. So I'm still going to make a video on objectives and of course on objectives, outcomes, goals, planning, and all of these things, just to explain what they are in details, okay? In details. All right. Once again, thank you guys for watching. Questions, comments, the comment section is pretty much open. Until next time, I'll see you guys and have a wonderful time. Till then, thank you.